I'm very happy this morning. I'm actually having a chance to chat with Marc Hamilton. Marc Hamilton is the president of Eurofin Canada. And we've been discussing fantastic technology, Marc, and thank you very much for being with us today. I know our attendees at our AGM will be very happy to be able to learn about the technology and the company. So why don't you take a couple of minutes, Marc, and tell us a little bit more about Eurofins globally and specifically in Canada.
So Eurofin has been founded by Gilles Martin back to 1987, and now we are worldwide. We have more than 800 laboratories in 45 different countries. We have more than 45,000 employees across the world. So we have base in Canada since 2017. We are in Quebec, we are in Ontario, we have 5 laboratories and 10 point of care in all Quebec and Ontario. We are based at Ottawa, Kingston, Toronto, and St. Catharines. So we are very near of our clients, and we want to go further across the Canada and in the future.
Merci beaucoup. Thank you, Marc. We should talk about technology because I think that's what's really interesting. I mean, learning about the technology of your organization, the fact that you guys do testing on surfaces, wastewater, masks. So I want to ask you first. Let's talk a little bit about wastewater testing and what's the process? What does it consist of?
Yes, it's a brand new validation, a brand new technology. So on our side, Eurofins choice to works to determine the presence of COVID in different environmental metrics like wastewater, ambient air, mask, and on surface. So if we talk about the wastewater, it's quite simply. It's not easy to analyze, but it's quite simply to understand. So everybody infected by COVID have a big bunch of COVID-19 cells in the feces. So all feces go to the wastewater. So for example, for a municipality, if the municipality or a nurse house or a hospital wants to determine if there's some problem of COVID infection, we just analyze the wastewater. So how it works? We need to use an auto-sampler unit and pump the wastewater at the on the main piping of an hospital or a specific area of a municipality. After 24 hours of auto-sampling pumping, we take the sample, which is the wastewater, and after that we will do the extraction of the COVID-19 on the wastewater and determine the quantity of the viral load on each sample and see if the sample contained COVID-19, and also we could determine if the quantity is on increasing, on decreasing, and see if there's an outbreak on a specific area of the municipality, or to see if the outbreak is on increasing on an hospital, a nurse house, or some kind of residence. So we did some testing with a big municipality in Quebec and also on campus, and it works really well, and it helped. The ministry and the public health to see if there's some outbreak on a specific area of the provinces, on the municipality, or on specific area that we want to see if there's a problem there.
I find it very interesting, very fascinating, actually intriguing, because obviously there's a lot of talk about testing on humans, because this is what is usually done, right? But I think the interest in the fact that your technology allows for testing on different surfaces and water. So, I mean, you talked a little bit about it, but what entities can take advantage, benefit from this process? So you mentioned municipalities, for example. You mentioned hospitals, I would assume, yeah?
Yeah, hospital, nurse house, a campus, university campus, for example. As you know, some young people are currently the most infected people in Canada. They spread all over easily, and they are asymptomatic for the majority. So the big majority of them doesn't have any symptom of the COVID, and that's the reason why it's easy for them to spread the virus. So, for example, if we could get the wastewater coming from a campus, we could see if the campus, usually a campus could have more than 100 students or 1,000 students living there, and to see if there's some outbreak or increasing of the COVID in the wastewater, and advice and also check if there's some problem there, and also give some good information to the university to see, oh, I have I think an outbreak starting in my residence, and do some coaching after that of that. Oh, go ahead, go guys, to see if you could get a human testing on you, and avoid for sure a spread of the COVID-19 on the school, for example.
So you actually get early data.
Yep.
Before we get into the human testing, before you close down areas or schools or even municipalities, you're able to get early data to help on those decisions, right?
For sure. Just in Quebec, there's some different zone color. Some city has a red zone. Red zone is the worst place. There's more than 100 people infected by 1 million people. And for example, if we are in Montreal or Quebec City, for example, and the municipality wants to know which subsection of the city have been more infected by the COVID. So it's easy by the wastewater to see, okay, this part of the city is the most infected comparatively at other area of the city. It's easy to do that by wastewater.
Well, let me ask you about wastewater. Obviously, is one technology, one method that you use. But let me ask you what I thought was very fascinating about being able to use masks, right? So we all have to wear masks now, and your technology allows for you to test on mask and get early data and determine also whether it's a business, an organization, or a campus where the virus is, right?
Yeah. So to analyze a worn mask is currently the most analysis requested that we get now. So for example, people working on a hospital, or people working on a specific plan, like food plan, and everybody need to wear a mask for working for a minimum of 4 hours. And if all people wear a mask, after 4 hours, if people are having the COVID-19, they cough under the mask, and they breathe under the mask, and all the masks catch the micro gootlets and the COVID parts. And after 4 hours of wearing the mask, we take the mask and analyze the presence of the COVID-19 on the mask. So it's very, very accurate, and I think it's 5 times accurate of the human testing. Our LODs are very low, and for example, we have a couple of clients using. We do 2 times a week, and we analyze all masks coming from there's employees, and it's some kind of a good sentinel. So it's a surveillance of the COVID spreading on the specific plant, and for example, we have been able to determine 1 people infected, and this people doesn't have any symptoms. So we determine an asymptomatic COVID-19 infection people just by analyzing the mask, and by this way we have been able to avoid to close a part of the plant for a couple of days, because to avoid an outbreak on the specific building, and it's good for the economy. You will avoid wasting time, because everybody knows if we want to go to if people goes to to human testing, COVID, it could take a lot of hours before having the services, and you could wait more than 5 to 10 days before getting results. So if you could have the result by 24 hours by each mask, you will be able to see if there's a present of the COVID very, very soon, and you could react easily to resolve the problem.
Do these tests actually replace testing on humans? And I think, you know, the question is important, and I'll give you a time to respond.
Yeah, that's a very good question. So no, for sure, this technology that we have developed on surface, on wastewater, on the mass, on swabbing, doesn't replace a human testing, because it's just to help people where is the virus spread, and give good information about where is the virus. Is it on surface? Is it on my mass? Is it on my wastewater? Just it helps to study where is the virus will go, and if my people is it infected. So for example, if we have a result positive on the mask, we will recommend to the worker, okay, we have a good chance that you have COVID because we have a positive result on your mask. So we recommend you to go at the hospital or a sampling place for human testing. And if the result is come back positive, you will need to stay at home for example, 10 or 14 days. So you just help people to understand where is the virus spread, and help also the municipality and all the people to see where is the virus.
Yeah, it's very interesting. I know time flies. I mean, you know, we could talk about this technology, fantastic, you know, for an hour, a couple hours. We'll have to do that some other time. But certainly, you know, I want to give you an opportunity to address the fact, you know, in this event here at our AGM, the main topic is about recovery, right? This is what we talk about. This is what the whole country is talking about in government, the recovery. And how do you see this technology support the discussion about recovery from an economic perspective, right? In Canada, how does it support our concern about recovery, and you know, from businesses and corporations?
So to recovery past the virus is about learning. You need to learn where is the virus, when I could catch the virus. So more you test, more you understand what will happen in the future. So for example, if we are able to help a municipality or a specific business to control an outbreak, or control people having like asymptomatic people in the workplace, we will help we will help the business to don't waste time, to don't have a lack of productivity, and also save money. So I don't know where the virus will disappear. I hope it will disappear by 2021 with the vaccine, or maybe disappear for in a couple of months. But during that time, more you test, more you will have a better understanding where the virus will go, and at the end of the day, protect the health of all Canadians.
Marc Hamilton, President, Eurofin Canada, Environnext. Thank you very much for being with us today. I know it was short, but it was very interesting, fascinating, and I invite all our participants at our AGM to be in touch with us and be in touch with you, and good luck with the development of your technology in Canada.
I appreciate it. Thank you so much.